I personally would rather tap out a little earlier
Yeah.
in a way that's a lot more peaceful. And I'm curious, like, how you see different people dealing with that. Do we deal with it the same here that people deal with it elsewhere?
Hmm.
What are your thoughts on that?
Oh man, death is such an interesting topic. I mean, I think the way you perceive death changes as you age, right? And as you grow older and as you experience death in your own life. I think that our culture has a very strange relationship to death in the United States compared to some other cultures, and how
In what
there
way?
there is this, like you just pointed out, this sort of relentless, like, I want everything done. I want everything done. I can't tell you how many people where I'm like, what are you doing? Like, this is actually like almost torture, like where we've had to call ethics consults because the doctors feel uncomfortable prolonging life that the family
Uh,
wants prolonged. And yeah, do we have machines that can do these things and your loved one is alive, but they're not alive. They're on 10 different machines. And as soon as you turn one of them off, they're dead. So, I mean, a lot of places, especially, countries that have socialized medicine, they don't spend money like that at the end of life. They will, or they won't offer things. Like, we don't have the resources to offer dialysis here. This is a futile treatment to offer dialysis. And so I think it's in part the healthcare, like, industry's fault. And because we're like, we can offer this and we can try this and let's try that. And then part of it is the mentality, like, I have the right to choose all these things for my loved one. And I tell my patients sometimes when I'm doing end of life, I say, you're not deciding whether your loved one lives or dies. Your loved one is going to die regardless of what you decide here. We're all going to die, and they're going to die sooner. The question is, how do you want that death to be? Do you want it to be calm and peaceful, or do you want to continue? And sometimes it's a process. It takes people a few days or weeks to kind of come around to understand it. But, there are countries where, people take their loved ones home and die in the home, and it's not scary.